These are the minds of medicine. This is their story.
It was supposed to be just a normal appendectomy, but when they pulled the appendix out, they found a growth on it which was cancerous, and it was a rare type of cancer, a mucus cancer. So the surgeon that did the operation made an arrangement with me to see Dr. Shah.
There is a tumor within the appendix that makes this mucus, and it'll keep making it and then spill it into the abdominal cavity. And that's what Gene had.
Dr. Shah, he didn't pull any punches. He told me if you didn't take care of it, the outlook was not good.
What happens is when you don't do anything about them, then the mucin continues to grow in the belly and the abdomen, and then patients have bowel obstructions, which would put them back in the hospital. Then their nutrition is affected, they start losing weight, losing muscle mass, and they tend to waste away.
Dr. Rupen Shah and his team at the Henry Ford Cancer Institute gave Gene Chelsea a new option, his only option. They would remove as much cancer surgically as they could. Then they would use a revolutionary approach to flood his abdomen with heated chemotherapy to kill the remaining cancer cells. It's called HIPEC.
These tumors are really caked on. If you can imagine like duct tape, and you're peeling duct tape off of your skin. Peel too fast, it's pretty painful. Peel too slowly, it's also difficult to come off. It's a combination of just knowing exactly the right way to approach these tumors.
A new treatment paradigm was this HIPEC, which is basically stripping away all of the peritoneal lining. And then while we're in the operating room, we put heated chemotherapy inside the abdominal cavity, close them temporarily, and this is done for about 90 minutes. It's going through a perfusion machine. And then we drain all of that fluid out and then close them back up.
Patients with this disease often start out in a little bit of a deficit, right? So they're a little bit weaker, maybe they haven't been eating well, so they really need to be optimized. We get them trained to talk to them about, getting up, get walking, get the best nutrition that they can so they're strong and ready for that surgery ahead of time.
Because of the challenges of cases like these, two surgeons will perform Gene's operation, Dr. Shah and Dr. David Kwan. Together, they will work at removing the tumors that have spread throughout Gene's abdomen and prepare it for HIPEC.
Having two people with expertise allows the collaboration in the OR to understand that things are moving along, things are not moving along, things have gotten too dangerous, things are not dangerous, and we can continue to proceed. Gene's disease was limited in such a way that we believe we could safely perform this operation while optimizing outcomes.
As surgery begins, doctors must be careful to remove as much cancer as they can without damaging delicate vessels in Gene's abdomen. Once the visible tumor is removed, they are ready to deliver the chemotherapy. They will place tubes and sew the abdomen closed. The heated chemotherapy will then wash over his internal organs. Doctors are hopeful it will kill any remaining cancer.
So as the fluid is heating up right now, we need to make sure that the fluid and when we give the chemotherapy is actually evenly distributed throughout the entire peritoneum. The chemotherapy is heated to over 100 degrees Fahrenheit, and it's hot enough to kill cancer cells, but not hot enough to kill the healthy cells. So the proposed benefit is that it will kill any microscopic cancer cells that remain.
Starting a program this revolutionary took the dedication of a team and, more importantly, the generosity of a family who suffered through a similar diagnosis.
In 2013, I was very fortunate to meet Lindsay and Brett Finsilver. Lindsay was a young mother who was afflicted by this cancer. She would talk about the fact that there was no one in the area that understood what she had gone through. She wanted to be able to provide this level of service locally here in Southeast Michigan. Through the generosity and the amazing generosity of her friends and colleagues, they were able to provide the initial seed funding that would allow us to start this program not at a grassroots level, but really as a system project that would just provide patients the best-in-class care.
I do know of patients when I was a resident here who used to travel to get this treatment, but now we are able to offer it here in Michigan, and it's very satisfying.
You need the passion of one person, one family, one cause, and you need someone to go after it so hard, so passionately, that everyone else buys into it. It was that spark from Lindsay and Brett that just really ignited this fire, and it's an amazing program where everyone is all in right now to provide patients that never had that opportunity previously.
I knew that anytime you get sliced from here to here and you have a machine put on you, something could go wrong. I could have not had it done. This is maybe 2 years, maybe 5 years, but it was a no-brainer. It had to be taken care of.
He's doing very well clinically. He's actually gaining some weight now. We also obtained a CT scan to see what his disease looks like, and as of now, his CT scan is cleared with no evidence of recurrence of disease. So overall, very happy. This was what this procedure was meant to do and intended to do.
The most thing I'm looking forward to is playing ball with my grandchildren again. I'm 74, and to give me a different outlook on life, time is the most valuable thing to me now.
It's inspiring to give somebody hope when they didn't have any, when there were no other options out there, no other actual feasible options for them to have something that could be beneficial to them. It always makes our whole team feel so good.
I can't say any more about this doctor. I mean, he just was great. I believed in him. And I guess you have to have some type of belief. I think that's a big part of survival. And basically, I wanted to survive.
To learn more about Henry Ford Cancer Institute's HIPEC program, or to make an appointment for a second opinion, go to henryford.com/HIPEC.